So first of all, I want to tell you that what happened actually. One thing I forgot to tell you, in radiation, basically the blood vessels are affected. The radiation actually damage the blood vessels, due to which the nutrient supply to the bone is actually delayed, and also there will be less blood vessels formation. So the healing is slow in that case during radiation. Okay, so that's why actually we first before the radiation we actually extract the teeth. Okay, then the teeth that are involved in the jaw, like in the mandibular or angular, sometimes the fracture can be the fracture can be maintained, but if the tooth is injured, infected, or severely laxated from the surrounding bony tissue, or either it interfere with the proper reduction or fixation of fracture, so the remover is usually indicated. Okay, so what happens that when the fracture can be in the line of angle of the mandibular, or either in the body of mandible, or symphysis region. When the fracture is within the fracture is in dentate area, it is known as compound fracture. Okay, means the fracture is present where the teeth is. But when there is actually fracture, means the fracture line passes through the root, it exposes the root and fracture. In some cases the line completely splits the tooth. Yes, that's also true. Okay, in such cases the extraction of the tooth, because now that has the tooth, now the fracture has been occurred, so the fracture has also been exposed. Okay, now if you don't remove it, don't and only fix the tooth, then it means that the source of infection is still there. Okay, that is very important, means you have to remove it. Chances of infection will be increased when the pulp necrotic because of any trauma. So due to that there will be ingression into the periodontal area and can affect the tooth line. Okay, so it is very important, when there is fracture you have to remove it. Okay, in the jaw. Another is actually financially. Sometimes patients cannot actually afford the RCT, so they prefer the extraction. Okay, now very important thing actually we'll discuss here is a cracked tooth syndrome. Cracked tooth syndrome actually occur due to the sudden trauma, either from a walnut that you are eating, or either or bony specule in the food, any hard uh, you on a hard object you bite mistakenly, so there's a crack line that passes from the pulp, then from the dentine enamel. When you bite on it, so there is an opening of dentinal tubules, means the dentinal tubules actually open and the signals reach the pulp. So when patient bite, he or she feels the pain, because what happened actually, that the crack line has passed the tubules, and then the tubules send the signals to the pulp. So what we do, methylene blue dye is a dye that is inserted into the tooth. This dye actually temporarily stain the tooth crack line, so we can visualize that easily. Okay, then also we have actually gentine violet methylene blue stain can also be used for the highlighting of lines. If the tooth line is crossing the furcation area, means it is crossing the furcation area, then the tooth should be extracted. That is very important point. Okay, if the tooth is cracked, so this is known as actually cracked tooth syndrome. Another point, sometimes we do actually pre-prosthetic surgery. Sometimes to make prosthesis for a patient, there are BDRs, broken down crowns, so we actually removed it so the patient can have a comfortable prosthesis. Okay, then we have also the extraction of new natal teeth. Sometimes the BB developed an extra teeth in first month of birth, so it is known as neonatal teeth. Or either we also extract the uh, those teeth that like we have secondary impactions present, or the primary teeth are retained and they are not giving the path for the eruption for the secondary teeth, so we also extract those teeth also, very important. Okay,